Good evening. I'm psychiatrist Jay Fulver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fulver, is there a connection between long-term psychiatric medication and being off balance? Not just once, I'm to the point of having to use a walker. My goodness, I would certainly recommend that you talk to your clinician about that, because you could be taking too high of a dosage of whatever you may be taking. And there are some medications at too high of a dosage will make you unsteady and give you difficulty with balance, and it can be due to their neurological disturbances as a side effect, but they also can be due to your having lightheadedness upon standing. That is not an expected side effect. That is not something that you should have to tolerate. I'd certainly talk to your clinician about that. Now, if you notice you're having more neurological disturbances as you get older with prolonged use of the medication, that can be a phenomenon with some medications called tardive dyskinesia. Medications that block dopamine. They used to be called the antipsychotic medications. Now they're called the dopamine receptor blocking agents. But these medications, by blocking dopamine, will increase the budding of more dopamine receptors and sometimes give you more difficulty with unsteadiness, tics, twitches in the facial areas, shoulder shrugs, trunk movements, and things like that. So either way, my goodness, I'd certainly talk to your clinician about that and see if something can be done about the current medication you're taking, if that appears to be attributable to the medication that you are taking. Now, you always have to go back to how you were feeling before you took that medication, and over the course of time, how it's helped you or how it's not helped you so much and possibly given you that side effect of unsteadiness. Thank you so much for your email. Let's go to our first caller for tonight. Hello, Craig. Welcome to Matters of the Mind. Craig, you mentioned that you're currently taking Zoloft or sertraline at 50 milligrams every day, and you feel like your anxiety's been under good control, but your doctor wants to raise the dosage. Is there a reason for the change if you're managing? Well, that's your call, basically, Craig. If you're managing well and you are saying the anxiety's in good control, the other question might be with Zoloft at least would be, is your depression under good control? 50 milligrams is a relatively low dosage for sertraline or Zoloft. Zoloft is typically dosed between 50 and 200 milligrams every day. So 50 milligrams is a relatively low dosage, but it's a common dosage for many people who primarily have anxiety. And the types of anxiety that we often address will be generalized anxiety, which is a fancy term for worry. Then you have obsessive compulsive disorder, which is often treated at a higher dosage, post-traumatic stress disorder, phobias, social anxiety, panic disorder. Those are all forms of anxiety. So based on the type of anxiety you're experiencing, the Zoloft 50 milligrams might be enough, but sertraline or Zoloft is also used for the treatment of depression, and maybe your clinician is identifying either with specific outcome metrics like a PHQ-9, for instance, where you get a numerical score on your depression, or maybe in talking to you, there might be some means of identifying that you might need a little bit more of a dosage of Zoloft. But quite frankly, if somebody in my practice is saying they're feeling really well on their current dosage of medication, I'm thrilled to keep them at a lower dosage if need be. So you're certainly entitled to be able to ask your clinician the rationale for the higher dosage. There might be some good reasons there that you might not be aware. Thanks for your call. Let's go to our next caller. Hello, Pam. Welcome to Matters of the Mind. Pam, you're having issues focusing on tasks as you get older. Is that normal? As we get older, it is normal to forget names more commonly. Is it normal to have difficulty focusing on tasks? I wouldn't accept that necessarily, because as we get older, our body kind of breaks down. And as our bodies break down, we can have things happen that can affect our focus and concentration. And as a clinician, I always want to assess those possibilities. Number one that comes, the top of my list will always be sleep apnea. Sleep apnea will be where somebody's snoring, they're pausing in their breathing, they're not getting enough airflow to their lungs, and thereby not getting enough oxygen to the brain. So sleep apnea increases its likelihood as you get older and your throat kind of collapses down in your airway as you're sleeping. Sleep apnea will make you tired and less focused the next day. That's the first thing we'll often try to address. Secondly, we'll look at thyroid disturbances as we get older, especially women will have lower thyroid, and low thyroid can certainly give you difficulty with focus. As you get older, sometimes you can have gastrointestinal bleeds where you can have a subtle little bleed and your iron can drop. When your iron drops, you can have difficulty with focus, you can be fatigued, you might notice some restless legs, which can be from low iron. So as the iron drops, that can give you difficulty with focus. As we get older, we're more likely to have type 2 diabetes, where you have increasing insulin, but it's just not working so well for you anymore, and you have gradually increasing blood glucoses. As those blood glucoses go up and down, that can also give you difficulty with focus. So we want to look at all these different medical reasons why people might have difficulty with focusing. I've certainly seen some people with depression. Clinical depression, as they get older, they're having more trouble with concentration, and they wonder if they're having dementia. But as we look through their various symptoms, specifically looking for the symptoms of depression, we'll find that that's an issue. We treat the depression, the focus can improve. So I wouldn't say difficulty with focus is necessarily normal. I'd want to look at a whole spectrum of medical conditions that can be possibilities for why a person is having difficulty with focus as that person gets older. Thanks for your call. Let's go to our next caller. Hello, Kim. Welcome to Matters of the Mind. Kim, you had mentioned that your partner gets more depressed around the holidays ever since his mother passed. How can you support him, and what advice do you have? I'd say over the holidays, Kim, certainly reminisce about your partner's mother and talk about the memories, because holidays will often remind us of fond memories of our loved ones. And it's great to reminisce and have a remembrance of the loved ones during those times, and reminisce during that time, and also focus on other things. Sometimes when you lose a loved one, you have to kind of refocus your attention on other tasks, and it's a new chapter in your life. But I'd certainly start with reminiscing about your partner's mother and talking about the fond memories and getting through those times to be able to help with that. Always reminding your partner that there are other memories that you can create that will be new and exciting as life goes on. Thanks for your call, Kim. Let's go to the next caller. Hello, River. Welcome to Matters of the Mind. River, you'd mentioned that someone told you that a rubber band would help you with picking, and you still have that urge. What else can you try? Yeah, a rubber band is something that's a distraction for annoying little habits that a person might have. You flick yourself with a rubber band, you're thinking about the little sting from the rubber band, so it distracts you from the picking itself. Picking is called neurotic dermatitis, and that's a condition where somebody is picking at their skin as a means of having anxiety. So number one, be aware that you're doing it. So what you do there is you identify the areas where you're picking, maybe cover those areas up. Some people back in the old days would wear white gloves. I don't see many people wearing white gloves anymore, but at least the white gloves would keep you aware of what your hands were doing and would inhibit the picking itself. Yeah, there are medications people take for picking. The one that comes to mind is one called inositol. Inositol is a B derivative of a vitamin B derivative, and inositol 6 grams twice a day can be helpful for picking. I'd want to know what the circumstances would be if somebody's picking. Some people will pick at themselves when they get anxious and nervous, so I'd want to know what that's all about and have them distract themselves from the picking to doing something else. So when you're starting to pick at yourself, you feel like you're kind of getting tense, do something such as 3 push-ups, some burpees, or some jumping jacks just for a few seconds to try to distract yourself from the picking itself, but try to identify the reason for the picking itself. Now, some people will pick at themselves because they have true dermatological lesions. So they have skin lesions of various types, and they're always picking at the lesions themselves. And dermatologists can help people with that. There's an old treatment for picking at the skin that's a tricyclic antidepressant medication, a tricyclic antidepressant medication called Doxepin. The trade name used to be called Sinequan or Atipin, and it's a medication that will increase histamine, or it'll decrease histamine transmission, and by decreasing histamine transmission, theoretically, it will decrease the urge to itch in the skin. Now, picking at yourself and itching at the skin is one thing. If you're cutting at yourself, because you're frustrated. And we often hear about this with adolescents. They'll get frustrated and they'll start cutting at themselves. When you're cutting at yourself out of frustration, it's not a good coping strategy, obviously, but there's a physiological reason why people do it. In the skin, there's natural opiates. And when you cut at yourself, when you're frustrated and you're angry, it releases these opiates that are in the skin. And naturally, you have this feeling of bliss when the opiates go to the brain. So it's kind of like an indirect way of taking endogenous opiates. It's not a healthy coping mechanism whatsoever, but there's a physiological reason why adolescents especially will cut at themselves when they get frustrated. The point there is, and the same with picking, try to identify the situations where you're picking or cutting and try to do something about those situations themselves. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Faulver, what is an SSRI? I recently started taking fluoxetine. That's an SSRI, correct? Are there side effects that I might encounter? A selective serotonin reuptake inhibitor, that's SSRI, a selective serotonin reuptake inhibitor. They started coming out in 1987 with Prozac or fluoxetine being the first of the bunch. And now we have 6 SSRIs. We have fluoxetine or Prozac. We have Celexa or citalopram, Lexapro or escitalopram, paroxetine or Paxil, Zoloft or sertraline, and fluvoxamine or Luvox. Well, I guess there are 6. So these are medications that will selectively and specifically block the reuptake of serotonin. So what's that all about? Well, if you think about your serotonin neurons, which are in the front part of your brain, and they are released in the Raphe nucleus, which is kind of in the middle part of the brain. It's the front part of the brain looking at you. Raphe nucleus is right there in the middle part of the brain, and that spews out serotonin. So think of the serotonin neurons being spewed out to the front part of the brain and various other parts of the brain as being kind of like a shotgun. A shotgun is like the neuron, the serotonin is like the shotgun pellets that are being distributed, and these pellets go to 14 different receptors all over the brain, and these 14 different receptors for serotonin do different things. So what you're getting with an SSRI is a blockade of the pellets getting sucked back into the serotonin neuron. So it's kind of like preserving your bullets by your shotgun being able to vacuum in the bullets after they hit their targets. So that's what our neurons do, because you just don't want to keep manufacturing more and more and more serotonin. Your brain couldn't keep up. So your brain has this remarkable recycling ability to vacuum in serotonin and thereby fire it again at the different targets. Well, a SSRI, or a selective serotonin reuptake inhibitor, will keep the serotonin bouncing around and hitting the targets for a longer period of time by blocking the vacuuming of the serotonin back in. So you get the serotonin bouncing around for longer periods of time. That can help with anxiety, can help with depression, can help with premenstrual symptoms, can help with post-traumatic stress, a lot of different things that increasing serotonin can do. If you increase serotonin with any of those 6 SSRIs, you can have a sense of a calming effect. So that's why SSRIs have an FDA-approved indication for, I think, 8 different anxiety conditions. They also have an FDA approval for depression, but they have FDA approvals for a lot of different anxiety conditions overall. And that's because increasing serotonin can give you a calming effect and somewhat of a feeling of a bliss. Now, the side effect of the SSRIs, increasing serotonin, can indirectly decrease dopamine. So the bad effects of an SSRI is you can feel like you're emotionally blunted. You feel no happiness, you feel no sadness, you just feel emotionally blunted. Now, for some people who have experienced uncontrollable crying, that can be a blessing. They feel, oh, thank goodness, I'm not crying in public. I used to go into a grocery store and just break down crying, and they're no longer experiencing that because they're on a serotonin reuptake inhibitor that's calming them down and not allowing them to cry. So that it can be a benefit, but it also can be a detriment, because people will say they can't cry and they can't express emotion as they could previously. Another common side effect from the serotonin reuptake inhibitors will be that if you increase serotonin, you decrease dopamine, and you can have sexual disturbances in some cases. So that's a common side effect that we see with the SSRIs. SSRIs typically have been, for the past 3 decades, first-line treatment for depression. But we have come to find that over the past couple decades that if you use SSRIs as your first line treatment for depression, you've got about a 2 out of 3 chance of they're not working. Now, about 1 out of 3 people are really good candidates genetically and from a family history standpoint for an SSRI, but they just don't work for depression for everybody. They tend to work really well for anxiety for a lot of people. For depression, kind of so-so. So if you're not getting adequate relief from Prozac or fluoxetine, we used to think, oh, we just need to increase the dosage. Well, we found that increasing the dosage just increased serotonin transmission even more, and it made people feel even more emotionally blunted, and that was actually detrimental to their treatment. So sometimes we just need to go to different mechanisms of action, and we have several other antidepressant medications that we can now use. So we have over 20 new developments with antidepressant medications that have come upon the market in the past 25 years. So we have a lot of other options outside the SSRIs, but that's a good place to start for some people if it works well. But keep in mind, it takes 4 to 6 weeks for them to give you the full effect. But if they don't give the full effect, we'll often ask people on a scale of 0 to 100%, what percentage improvement do you have with this? If somebody gives me a score north of 50% and they say the SSRI is helping me 60%, 70%, I might keep them on that and add something else. But boy, if they're only getting about a 20 or 30% improvement, I might bail out on that SSRI and go to something else with an entirely different mechanism of action. Thanks for your call. Let's go to our next caller. Hello, Jeff. Welcome to Matters of Mind. Jeff, you had mentioned that you often feel on edge and turn to having one alcoholic beverage to help you with your mood. Is that normal? Are there long-term effects? Well, that was a common self-medication for anxiety. 50, even 100 years ago, Jeff. That's what people have done for many, many years to deal with anxiety. They feel on edge, so what do? They have a drink. What does alcohol do? It goes to the little GABA receptor on the chloride channel in the brain and calms you down. Unfortunately, it can make you impaired to the point where it makes your front part of your brain not work so well. And that's why people do stupid things when they're intoxicated with alcohol, because they're basically anesthetizing their thinking part of the brain. The thinking part of the brain is in the front. That's the part of the brain that helps you make good judgments, to allow you to weigh the pros and cons of different behaviors and to be decisive in what you're doing. Alcohol anesthetizes that part of the brain. So it's not a good means to help you with anxiety. We have many other ways of helping you with anxiety. If you're having trouble with irritability, if you're having trouble with situations that are causing you to have excessive stress, number one, counseling can always help with those situations to try to talk you through them, because what you're trying to do in counseling is make the front part of the brain work better. And the way you try to make the front part of the brain better is by reasoning through the different situations and trying to think about your options before you act on them. But many people have such overwhelming anxiety that their little amygdala up here, it's on the left side and the right side of the brain, but the amygdala is in this temporal lobe, the yellow part of the brain. The front part of the yellow part of the brain has the amygdala as a little almond-like structure, and that's the part of the brain that's responsible for anxiety, anger, fear, rage, and that part of the brain can get really hot if you are out of control with your anger. If it gets to that point, if irritability is overtaking you, it can hijack the thinking part of the brain, so you don't think through your current situation adequately. Now, what will make that worse? Insomnia. So I'm often telling people that they need to be able to sleep well. If you don't sleep well, you're more likely to have a compromised effect on how the front part of your brain is working. So you have to get a good night's sleep to recharge the front part of your brain to allow it to work. Alcohol, again, it's like having a poor night's sleep. Your front part of your brain's not going to work so well. So I would certainly talk to your clinician about other possibilities on how you could get some relief like you're kind of temporarily getting with alcohol, but something that would be more efficient in helping with your concentration and helping you get through the situations you're enduring. Thanks for your call. Let's go to our next caller. Hello, James. Welcome to Matters of Mind. James, you want to know, what kind of medication, prescription or over-the-counter, would I recommend for ADHD, attention deficit hyperactivity disorder? An example would be if your mind wanders when reading a book. Well, the first thing you want to do, James, when we talk about prescriptions for ADHD, over-the-counter medications for ADHD, if your mind is merely wandering, that might be not symptomatic of ADHD itself. It might be that something else could be going on. So I'd want to, number one, make sure you have a good clinical assessment. And the best way to really diagnose ADHD will be if somebody is getting a questionnaire. There's an adult ADHD self-scale, self-rating scale that you can actually get online, and that's what we often use. We want a thorough questionnaire, a thorough assessment of the problem at hand, because we want to know what we're treating. I mentioned earlier, sleep apnea, low thyroid, iron disturbances, diabetes. Those all can give you difficulty with your mind wandering over the course of time. So with ADHD, we want to know, did those problems start when you're a young child, and have they gone on persistently day by day? Now, granted, your focus and difficulty with concentration can be worse on the situations in which you're trying to concentrate upon. So if you're having difficulty with something that's not new or challenging and it's kind of boring, yeah, that can make your mind drift a little bit more. So is that clinically significant for ADHD? Over-the-counter type of treatments for ADHD, the number one thing that many people have used for many years is, quite frankly, caffeine. Coffee shops are often loaded with people who have ADHD. If you're going to use caffeine, be careful about the caffeine, because doses over about 400 milligrams a day can be problematic for a lot of people, where they get the shakes, fast heart rate, gastroesophageal reflux. You can have side effects as you get the higher amounts of caffeine, but it's quite frankly a way in which many people self-medicate their ADHD. The key with caffeine use is to use small doses over the course of several hours. So don't take a 200 milligram tablet and you get a surge of energy, and you might get a little bit of relief from the ADHD for an hour or so, but then it'll be gone. So you don't want to take a surge of caffeine if you're taking something over the counter. Same with coffee. You want to sip it slowly over the course of a couple hours to try to help with focus and concentration. Coffee has, caffeine in general does have a remarkable effect in keeping you awake as the day goes on, because as the day goes on, you'll have these kind of like natural exhaust fumes in the brain. We have ATP, adenosine triphosphate. ATP is the energy for the brain, it's the gasoline for the brain, and the fumes for the brain would be adenosine itself. So adenosine is kind of like the exhaust fumes of the energy that we're burning in our brains. As adenosine gets released, it goes to these adenosine receptors in the brain and makes you tired. So that's why you naturally can get a little bit more tired, a little bit more foggy around 2 p.m., 3 p.m., 4 p.m. as the day goes on. So as the day goes on, you can have a little bit more difficulty with focus. How do you get past that? The best way is to get a 20 or 30-minute nap, midday, late afternoon, perhaps. 20 or 30-minute nap is often all you need to clear away all the adenosine. But another way to clear away the adenosine is by drinking coffee or having a caffeinated beverage, because caffeine will knock adenosine off the receptors and thereby allow you to be more awake. Caffeine also has the added benefit of increasing norepinephrine and dopamine just a little bit, not to the degree of a stimulant, but it can increase it just a little bit. We use a medication for depression called Wellbutrin or bupropion. Depression treatment that increases dopamine or norepinephrine can increase the efficacy of medications used for stimulants, because bupropion has about half the potency of a stimulant and stays in your system the whole day. So we'll sometimes use bupropion or Wellbutrin as an antidepressant medication for ADHD because it stays in the system the whole day. And then we can use stimulants and sometimes non-stimulants on top of that if need be. There's a lot of different stimulants and non-stimulants. The key in taking a stimulant is, number one, make sure you do have ADHD. Because if you take a stimulant, you don't really have ADHD, all it's going to do is give you more energy. Well, you might think, well, that sounds great. Well, it'll give you more energy, but that's kind of artificial energy, causing you to crash thereafter. And they've actually done studies on people who took stimulants if they didn't have ADHD, and those people would have worsening concentration and worsening focus if they didn't have ADHD and they took a stimulant. So simply taking a stimulant is not going to necessarily improve your concentration and your ability to pay attention. It might increase your energy, but it's not going to necessarily improve your concentration. So we have to be scrutinizing on the people to whom we give stimulants versus the ones to whom we do not. Thanks for your call. Let's go to our next email question. Our next email questions reads, Dear Dr. Farber, why does turkey make me tired? I always feel like taking a nap after Thanksgiving dinner. A classic question for many, many, many people, and I think most of us know that answer, tryptophan. But let me give you a little bit of detail on that. Tryptophan is the building block for serotonin. Turkey has tryptophan in it, so basically when you're intaking turkey, you're increasing your tryptophan levels. Tryptophan is a building block for serotonin. I mentioned earlier that fluoxetine, as well as for the 5 other SSRIs are out there, they're increasing serotonin. When you increase serotonin, you have a sense of blissfulness and you have a calming effect. And for many people, they can feel sedated. Thanksgiving dinner also brings to the table, literally and figuratively, a lot of carbohydrates. So carbohydrates with tryptophan will give you an especially tired feeling because the carbohydrates will increase tryptophan transport into the brain by increasing insulin. So if you increase your carbohydrates with potatoes and desserts and all that kind of thing, you're increasing insulin transmission. When you increase insulin transmission will cause the tryptophan to have an increased flow into the brain because the blood-brain barrier is there that will kind of prevent things from going in at certain rates. Insulin promotes tryptophan intake into the brain. That will even give you more of a likelihood for having increased serotonin transmission. So if you increase tryptophan within a matter of 20 minutes, you can start increasing serotonin transmission in the brain. That's why you get tired after a turkey dinner, especially if it's accompanied by a lot of carbohydrates. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air concerning mental health issues, you may write me at Matters the Mind, all one word, at WFWA.org via the email. I'm psychiatrist Jay Fulver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. I'm psychiatrist Jay Fulver, and you've been watching Matters of the Mind. Thanks for watching. Have a good evening. God willing and PBS willing, I'll be back again next week. Take care.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.